About 1 in 5 Americans have GERD, often known as acid reflux or heartburn.
Most people take pills over the counter and prescription to control the problem, but that can be harmful long term.
Yeah, here to introduce us to a new solution, Dr. Sumeet Mittal, Director of CHI Health Esophageal Center. Good to see you, Doctor.
It's nice
Thanks
to have
for stopping
you
by
here.
this morning.
Good morning.
Good. Can you do anything about her? She's very sick today.
Well, I'm a little down with cough.
We're
We're in the same boat.
It's going all over the place. But really, we're talking about acid reflux here, or heartburn, right? Can this be a big deal?
Well, first of all, I want to correct you that it is not just acid reflux disease. It is reflux of gastric contents. The stomach contents come up. They happen to be acidic, but even if you suppress the acid, the reflux will still continue. So it's more important for people to understand that it is a reflux disease because of a non-functioning valve.
You reduce the acid, you reduce the burn, but you still have the reflux coming up.
Yes, exactly. So one of the most common symptoms and the immediate symptom is a heartburn, and that is very well taken care of if you suppress the acid. However, the reflux will continue. And so it's important that we understand as we go take care of the disease.
We mentioned the pills, which a lot of people are taking, but they come with warning labels if we're paying close enough attention.
Yes.
What's the harmful effect of doing them long term?
Well, first thing to accept is that we evolutionarily designed and developed this way that we have a high amount of acid in our stomach that helps us neutralize some of the harmful pathogens that we swallow and help digest food. And as treatment of acid or reflux disease, we suppress that acid very profoundly. So we are altering a normal physiological mechanism, but it doesn't stop the reflux episode. So there are some side effects of chronic acid suppression, and that includes some mineral deficiencies such as calcium and magnesium. They can have increased incidence of Clostridium difficile diarrhea and increased pneumonia and bone loss. So there are increasing concern about long-term side effects. They're relatively safe medications as they come, but they can be because people need to be on for 20, 30, 40 or longer years.
Yeah, so they can create bigger issues, long-term use. Just talk about this new option. It's called, what's it, LINX procedure?
Yeah, that is just one of the newer alternatives to stop reflux. The way I address it with the students and the patients is that reflux happened because of a not properly functioning valve at the bottom of the esophagus.
And this is what we're talking about
and
right
this
here.
is what we're talking about. If the valve is not working, there is going to be reflux of contents. Now, traditionally, we have a surgery that works very well. However, it has some side effects, which is a fundoplication, and maybe it is too much of a treatment for people with early reflux disease. And this alternative that has been developed and now available for the last 4 to 5 years in the world could take care of the people with early reflux disease. The gold standard is still the surgery, which is the fundoplication. However, this is an alternative for early reflux disease, and that would be an alternative.
That little, it was flat, and you have it here. I don't know, Grant, if we could show this close up, and then explain how it works and why.
So basically, it is a string of beads. It's actually kind of the thing that you wish you had invented because it's so ingenious that you put it around the esophagus. So it's different sizes. We measure the patient's esophagus size with little poke holes in the abdomen and then put it around the esophagus. So it goes around like a bracelet right at the top of the junction where the esophagus meets the stomach. And what it doesn't squeeze the esophagus closed. What it does, it prevents it from opening of the sphincter up, and that prevents reflux. The earliest causes of reflux is that the sphincter opens up from below, allowing the reflux to happen, and that prevents that from happening.
It still allows food
to go
down. Come down.
Yes,
because stuff from going up.
Because a bead of magnets, when the food is coming down, it spreads to let the food go into the stomach, and then it squeezes back to the size, preventing it from opening up. As you can see in this cartoon, that we can put it right there around the distal esophagus, and when the food comes down, the beads separate, allowing the food to go in, just like they did, and then because of the magnet, they come back together.
This is incredible.
Now, the action is not to squeeze it, but to prevent it from opening up
farther. What is the success rate for this procedure? And patients that get this procedure, do they have to go on medication after this, or how does it work?
Well, once you fix a broken pipe, you don't have to keep putting perfume to stop the severe sting.
Right.
So you do not need to be on medication. This procedure has been out for about 5 years, and about 3,000 patients have been done worldwide. More than 97% of patients are off their medical therapy since the procedure is done. and it has been very successful on patients and very good outcomes.
Is it minimally invasive?
It is done with 5 little poke holes. It's laparoscopic surgery, and they're mostly home the same evening or early next morning.
How nice.
That's incredible.
Yeah.
So who do you recommend if somebody comes in? Is this right for a particular type of patient?
The most important thing for a person to think is, don't think of reflux disease as acid reflux disease, and understand that medicines are great. They help a lot of symptoms, but they don't treat the disease, they don't cure the disease. About 50% of people, in spite of being on medication, still have symptoms. And in the 50% of people who are completely symptom-free, they have concerns what is going to happen with long-term medicine use or long-term side effects of damage to the esophagus. So people who are on more than once-a-day medications, who have breakthrough symptoms, coughing, some asthma, should consider that maybe we need a mechanical control of the broken valve rather than just a chemical or a perfume control.
How do you know what type of patients are eligible for the procedure? How do you know if you're eligible?
Well, if somebody has chronic reflux disease and is on chronic medications with or without breakthrough symptoms, should consider getting a surgical intervention or a mechanical fix. Now, we will evaluate and see whether their disease is early enough that they can get the LINX procedure, or whether they would be better served with a more standard, a little bigger and a little more involved procedure, but the workup for the both procedure is same. So somebody with reflux disease wants to consider getting off medical therapy or has symptoms that are not controlled with medications, we would evaluate them and see that which, number one, make sure they have reflux disease. What we find that a lot of people who've been diagnosed with reflux actually don't have reflux, and we have to find alternate reasons for their symptoms and take care of that. So proper evaluation is needed rather than just throwing a bunch of pills.
Let's show you some information about the CHI Health Esophageal Center. And while we look at this, should our viewers have a referral from their family physician before coming to see you, or can they just call themselves?
Either works well. I always encourage that the primary care physician should know what the patient is going through, because they are the most important physicians. That the most important doctor is going to take care of the patient. So even if they approach us directly, we would always let their primary care physician know what we found and how we're going to take care of them.
This is fascinating,
It is
Doctor.
fascinating stuff. Yeah, you guys are doing good stuff down there, Doctor.
We appreciate
Good
your
work.
time today.
Thank
and
you.
get well.
Yes, I do need to.
Me and you both.
Thank you.
Ahead this hour, we'll talk to one of the most successful college basketball players ever, Christian Laettner, and get his Final Four picks this March. If you can't stay with the TV, watch live on your mobile device, or you can check out the clip later at OmahaMorningBlend.com. Next, a topic that's hard for many families, losing a pet. The difference pre-planning can make, as a woman who can guide you through it is going to join us.